So I think right now, this is the tip of the iceberg as far as airborne disease with coronavirus is concerned. All right, everybody, welcome to another video. I'm Dr. Ford, the NICU Doc. So recently I've been reading more and more about coronavirus and the possible transmission from the mother to the baby. There doesn't seem to be a lot of a vertical transmission, but what about airborne? Is this the answer? Is that why there may be some babies that within a few hours are showing positive for COVID-19 or coronavirus? Let's get to that topic. So today we're going to be talking about the possibility of airborne transmission from mothers to the baby. First of all, we're going to discuss what is airborne transmission and how is that different from contact or droplet. We're also going to be looking at the possibility and some studies that have shown babies that came out very soon after birth already being positive. And could that be airborne transmission or maybe vertical transmission? We're going to be talking about the differences. Then we're going to discuss a little bit about skin to skin and maternal breastfeeding or giving mom's milk to the babies and whether this is a risk, especially in light that there may be actually airborne transmission. And then lastly, I really want you to stay to the end of the video because we're actually going to be looking at one study that may prove that there is vertical transmission from mother to the baby of coronavirus. So make sure you stay to the end so you can definitely learn more about that study and all the other studies I'm going to be talking about. All right, let's get to today's video. Let's do it. So first of all, let's talk about what is airborne transmission. One of the common things that we've been hearing a lot about COVID is that it actually gets transmitted through contact or even droplets. This is why we talk about using the masks. Now, what contact is basically that you have a virus, you're contagious, you're carrying it, you put it on a surface, somebody else comes in, touches that surface. It may be something like opening a door, and then you go ahead, somebody closes that door or opens that same door, they now have the virus. And that's the way they get transmitted. With droplets, what that is that you have a short distance where there is that virus contained in droplets, where if you're talking, if you sneeze, if you cough, there's a short distance where that virus is carried by basically fluid and droplets. And most studies have shown that it's up close to or about 6 feet. The great majority, 80 to 90% of those droplets only carry to that amount. Now, with airborne, you basically have more of a puff, if you will, of the virus being transmitted. When you go ahead and cough, the great majority falls within 6 feet. That's your droplet. That's a certain area. The airborne can actually travel, and there are some studies showing that it could travel as much as 20-25 feet of distance with very, very small amount of droplets being carried by air or by the environment. And so you can imagine if you are wearing your mask or if you're just talking and you're 6 feet from somebody, you could still transmit that in a closed room environment. And obviously there are cases of that happening all over the United States and around the world where they've congregated into meetings, even at 6 feet apart, you have had the contagion. You have had, unfortunately, patients or people that have gotten sick, that have been contracted the coronavirus and developed COVID-19, and unfortunately some have died. We are seeing more evidence that COVID-19, that this coronavirus could be carried by airborne. And even now, the WHO is coming out with a statement that they cannot say that this does not occur. So there is that possibility. We're seeing more evidence to it. Now let's actually see if this evidence could be applied to some of the studies that have shown that babies are turning positive very quickly after delivery. Okay, let's address skin to skin and breastfeeding. Of course, skin to skin is the best thing in the world. There's so many things that are really important with bonding. Babies do so much better with skin to skin. Same thing for breastfeeding and breast milk. We know that's better. But right now in the time of COVID, is this right to do? Are we able to do this safely without increasing the risk to the baby getting coronavirus infection? So let's talk a little bit about that. Studies have shown that babies that don't receive maternal breast milk are actually at 14 times higher the risk of dying just because they don't get maternal breast milk. So you can see already that it's so important for babies to get maternal breast milk with those immune mechanisms already prepared and helping the baby to fight infections, in this case, the coronavirus infection. So the World Health Organization talks about this and the importance of balancing the risk of COVID versus the risk of not breastfeeding, and how it is so important that the actual breastfeeding itself and the skin to skin can be protective against just general infections and viruses. One of the studies that they quote shows that out of 46 mothers, really only 3 of those mothers were found to have viral particles within the breast milk. What this viral particle means, it does not mean live virus. This virus does not or did not infect the breast tissue, did not pass to the baby, but more so they found pieces of the virus. Now, of these 3, there was 1 baby that contracted and actually developed COVID-19 infection. However, they could not determine whether this was directly from the breast milk of the positive mother or whether the baby got it from just contact, from droplet, or as we're talking about, maybe even airborne transmission. One other thing that's really important about breastfeeding itself and breast milk is that the breast milk actually has something called immunoglobulins. Immunoglobulins are basically fighting cells. They're used for any type of infection of viruses and bacteria. When they come into your body, these immunoglobulins, they go in, they attach it, they send signals to your body to send all the attack cells to eliminate that foreign body. So we know that it's really important for the babies to get maternal breast milk because actually mom has already started the process of defending the baby by giving part of the immunoglobulins through the breast milk to the baby. It's a huge plus for the babies to get that maternal breast milk. And if we feel that it can be done safely using mom's mask, washing hands consistently, and this is the best thing for the baby, it actually can be very protective. So it's important to balance the risks of giving the maternal breast milk, breastfeeding, doing skin to skin, and the risk of actually getting the infection. Okay, knowing now that there is more and more evidence that there may be airborne transmission of this coronavirus, let's look at the evidence of studies that have shown babies turning positive very quickly after birth. So there was a nice meta-analysis done looking at 222 infants that were either born to mothers that were suspected or were positive for coronavirus, or that the babies were admitted fairly recently after birth and shown to be positive or suspected for coronavirus. So what this meta-analysis showed was that 13 out of 222 infants turned positive fairly soon after delivery, within days. Specifically, 36 hours up to 17 days, these babies were turning out to be positive. Now, of this, really only 1 initially tested positive within the first 36 hours, and on retest, it was negative. What was interesting was out of all these 13 patients that were positive, the mothers were tested with amniotic fluid, with vaginal fluid, with the placenta itself, all the fluids surrounding a birth and a delivery, and all the samples were negative. So it sort of gives you the idea, if nothing was happening during the delivery yet, they became positive fairly soon after, even with all the restrictions and limitations, even using masks, even using sterile equipment, they became positive. Could it be because this virus really is airborne, and even with everything that's protecting, the solution or the breathing out that, or coughing or sneezing, breathing out this coronavirus could be traveling to the baby, and the babies are becoming infected very quickly after that. So it gives you a case towards the airborne transmission from the mother to the baby soon after birth. So there was a recent study done in my hometown of Peru. Now this study showed a mother who presented with 4 days of general malaise, fatigue, not feeling well, feeling tired, and a low-grade fever. She presented at 33 weeks gestational age, and she had been in contact with a partner who was positive for SARS-CoV-2. She then herself became positive a day after admission. When they first looked at the immunoglobulins IgG and IgM, they were actually negative. But when they tested at 16 hours of life, the nasopharyngeal swab, which is again a small sample of fluid from the nares, from the nose, from inside the nose, that RT-PCR, that reverse transcriptase polymerase chain reaction result came back positive. They repeated a second one at 48 hours, and it did show that, again, that it was positive for coronavirus. So this has you thinking. Is it possible that there was some vertical transmission, meaning this passed directly from the mother through the placenta to the baby? Or did the baby get it immediately after being exposed to the air, if you will, to the environment where mom had been positive? Even with all the precautions, it only takes one droplet of virus to go in and replicate. So it's possible that this is an evidence of airborne transmission. Now, what this study failed to show was actually the tissue samples of that mother. Was there amniotic fluid that was positive? Was the placenta positive? And so we don't have the whole picture. And there's multiple studies showing this, that within few hours to days, they seem to come back positive, even though, again, other studies have shown that the placenta and the amniotic tissue is negative. Now, stay for the bonus, because I am going to be talking about a most recent study that just came out here in July 2020, showing that there actually may be evidence that there is vertical transmission from mom to the placenta to the baby. Stick around to find out. So thank you again for staying to the end. And this is really important, so I'm glad you did. Because we're going to be talking about the one case that just showed up here in July 2020, showing that there actually may be transplacental infection of coronavirus. So this is a case of a mother who presented and was admitted because of a fever of 38.6 and a profuse coughing with a lot of sputum, with a lot of mucus production. This mom was actually tested, and she did have the coronavirus infection. They tested genes E and S, and it was detected not only in the blood, but also in the nasopharyngeal samples and in vaginal swabs. And both that unruptured amniotic fluid that was collected and the placenta, they were both positive for the E and the S genes of coronavirus, of SARS-CoV-2. So that baby was delivered at 35 and 5/7 weeks gestational age. They sent bronchoalveolar lavage fluid to test. And this is basically liquid that's coming out from the baby's lungs and the trachea. When they sent that, it came back positive. The baby ultimately did very well. They took the breathing tube out and has actually done very well without any problems. But it shows that both the baby was positive, the placenta was positive, the amniotic fluid was positive, and the mom was positive. This is basically the first evidence that we've seen of positivity all throughout, from the mom to the placenta, the amniotic fluid, to the baby being positive. And luckily, the baby's done very well, but this is the first case that we're seeing that could actually prove that vertical transmission is there. So I worry as this coronavirus continues to spread, we're going to begin to see more cases, either of vertical transmission coming from the mom to the baby, or we're going to be seeing more of the evidence showing that there is airborne transmission. What a lot of people don't know is that not only can you get the infection from the oral route or the nasal route, you can actually also get it from getting the infection and the virus into your eyes. So it's really important, if you're going to be going to a delivery, if you're going to be attending, that you are not only using your protective device, but also you're protecting your eyes as well. So at the moment, the healthcare authorities are not recommending the use of an N95 or an airborne precaution mask in the general population out in the real world. However, if you are exposed to the possibility of getting droplet, of being exposed to a patient that is COVID-19, it is imperative that you wear this type of protection to be able to not only protect yourself, but again, protect the patients that you'll be working with. And with that, we have to wear these goggles or a face shield to be able to protect yourself from the possibility of that virus entering through your eyes. So this is extremely important. It's hard to breathe. It's uncomfortable. If you wear it for many hours, it's gonna leave some lines, it's gonna leave some marks. You know, for us, when we go to the deliveries, we are completely gowned up. We completely protect ourselves so that we can also protect our families and protect our patients from this horrible pandemic until it's all over. What do you guys think about the possibility that this is an airborne disease, that the contagion, that you can actually get these viruses just from being in a room full of people who are talking? Do you think this is real? Are we going to be getting more information? Are we going to start having to wear N95s? What do you guys think? Love to hear that. So please put it in the comment section. So I think right now, this is the tip of the iceberg as far as airborne disease with coronavirus is concerned. I do think that we're beginning to see more and more evidence come out. I think we're going to be able to see more evidence that will lead to recommendations from the healthcare governing bodies to be able to protect ourselves from this pandemic, to be able to control it, to placate it, to be able to give time for the vaccine to be instituted, to start working, to get herd immunity and be able to protect ourselves. So this is hopefully just a distant nightmare. But in the meantime, please, you have to follow your recommendations from the state, from your governing bodies, to be able to take care of yourself and take care of your loved ones and your family. Okay, there'll be more on coronavirus, as you know. Keep on reading, keep on learning, and I want to be able to give this back to you so that you guys are also up to date with the most recent information on coronavirus and pregnancy and babies and the whole NICU stuff. Okay, so thank you again for watching. I really appreciate it. Again, if you like these videos, please like, subscribe, hit that notification button so you can see my videos as soon as I post them. And I will see you with the next video. You guys take care. Bye.